This audio course is designed to help you prepare for the National Council Licensure Examination for registered nurses. There are 4 parts in this course. The first and most important is an in-depth review of all major sections of the NCLEX-RN, including safe and effective care environment, health promotion and maintenance, psychosocial integrity, physiological integrity, and many more. Each topic is thoroughly discussed and then followed by a question and answer and definition session to reinforce the material reviewed in the context of the actual NCLEX test. Next is a comprehensive review of common pharmaceutical drugs, professionally narrated by an experienced medical doctor to ensure accurate pronunciations. This section is designed to help familiarize you with the 500 most commonly prescribed medications in the United States, including their generic and brand names, dosages, indications, and contraindications, mechanism of action, and major side effects. The pharmaceutical drugs review is followed by a medical microbiology review. In this section, we'll review the top 150 pathogens you need to know about. We'll go through their morphology, pathogenesis, defense mechanisms, and available treatments. Last but not least, we'll conclude the course with a complete audio review of medical terminology. Here you'll discover a proven method to decipher any medical term from its prefix, suffix, and root word, plus get an overview of the 500 most commonly used medical terms. We've taken great care to present accurate, bite-sized pieces of information that will help you prepare more effectively and be more confident on the test day. We recommend listening to this audio course at least twice in its entirety, then revisiting areas where you may need more help. We wish you all the best in your future endeavors, and thank you for choosing AudioLearn. Now let's get started.
Whole blood is made up of RBCs, plasma proteins, and plasma. Hypovolemic shock from hemorrhage is the main reason for administering whole blood. ABO is a kind of antigen system. Recipient's type must be compatible with ABO type. Type AB matches with A, B, or O. Type O matches only with O types. Type B matches with B or O types. Type A matches with A or O types. A hemolytic transfusion reaction occurs due to blood type or Rh incompatibility. Patients with a history of allergies often have an allergic transfusion reaction. When WBCs, white blood cells, are reacted to by antibodies directly against them, a febrotransfusion reaction occurs. When contaminated blood products are transfused, a bacteriotransfusion reaction occurs.
Welcome to the section on analgesics and anti-inflammatories. Analgesics refer to drugs which relieve pain without causing loss of consciousness. Anti-inflammatories are used to counteract or suppress the classic signs of inflammation. These include acute pain, heat, redness, swelling, and loss of function. Histologically, inflammation involves a complex series of events. This includes the dilation of arterioles, capillaries, and venules, increased permeability and blood flow, and the exudation of fluids. Here's an overview of analgesics and anti-inflammatories. First drug in this category is acetaminophen. Acetaminophen is available under the brand name Tylenol. Acetaminophen is a para-aminophenol type of non-narcotic analgesic. Acetaminophen reduces fever by affecting the hypothalamus. This leads to sweating and vasodilation. This also inhibits the effect of pyrogens on the hypothalamic heat regulating centers. Acetaminophen is used in the control of pain due to headache, earache, dysmenorrhea, arthralgia, myalgia, musculoskeletal pain.
The influenza virus. The influenza virus is the cause of the common flu. Complications of the flu can result in pneumonia in senior citizens and Reye's syndrome in children that take aspirin. The influenza virus is a negative single-stranded RNA orthomyxovirus. The influenza virus expresses potential virulence factors, including hemagglutinin glycoprotein that binds to the red blood cells. It can also bind to the receptors on the cells of the upper respiratory tract that can result in viral RNA being dumped into these cells. The influenza virus can also cause neuraminidase glycoprotein, which is a breakdown of neuraminic acid. The influenza virus can be treated with amantadine. It can be prevented with a vaccine that prevents upcoding of influenza type A.
Take the term pericarditis. It's made up of a prefix, para, meaning surrounding, the root word, card, the heart, and a suffix, itis, meaning inflammation. So we deduce that pericarditis means inflammation of the membrane surrounding the heart. Cholecystitis, inflammation of the gallbladder as a complication of gallstones. Cholestasis, stagnant flow of bile from the liver. Cholesterol, the most common type of steroid in the body, critical in the development of bile acids, vitamin D, estrogens, androgens, and certain hormones. Cholesterol is also important in maintaining normal function of cell membranes. Epilepsy, a pattern of repeated seizures, may be caused by blows to the head, fever, or inherited disorder.